On August 12th, 51 inmates at the Smith County Jail were in isolation after being exposed to coronavirus. 2 days later, that number more than doubled to 117. Now there are 170 inmates in isolation. Our Matt Lackert spoke with the Smith County Jail about how they're trying to stop the spread.
This isn't the first time the Smith County Jail has faced a coronavirus outbreak. The newer cases stem from a group of inmates who were working outside the jail only to return with symptoms.
They started feeling ill. They came back in and they were all put on quarantine.
When some of these inmates tested positive, they needed to quarantine the entire cell, which led to the initial isolations at the jail. CBS 19 initially spoke with Chief John Shoemaker with the Smith County Sheriff's Office on August 12th, when there were 15 positive cases of coronavirus among inmates and 11 among staff. At the time, he was able to confirm 15 COVID-19 tests had been administered. Now, more than a week later, he doesn't have an exact number of additional tests given, but believes it's around another 15.
We're actually going to do a mass test Monday for inmates at low risk and inmates at the central jail.
There are currently 22 inmates with positive cases and 11 staff members. Shoemaker estimates roughly 120 inmates will be tested.
There's 96 at central jail, and there will be another 24 at the low risk facility.
Coronavirus isn't the only problem at the Smith County Jail.
We had an issue with the medical staff not being there at our jail.
Chief Shoemaker wouldn't share what led to the walkout, but he says for an hour on Saturday, there were no medical personnel at the Smith County Jail. He says there are typically 3 medical staff on duty at a time at the central jail and 2 at the low-risk jail. Shoemaker says the situation has since been resolved and the staff has returned. We've got your covered, East Texas. Matt Lackert, CBS 19.
The number of inmates in isolation on Wednesday was 180. 10 of those inmates have returned to the regular population.